Hi, we're going to briefly talk about nerve blocks. As a reminder, this is not by any means an exhaustive introduction. It's simply a general introduction to how the process works. Additionally, the goal is to teach you some basic physics along the way. So if you're doing a procedure like this, the way you'll see this done in the hospital involves a couple of steps. You'll see it's a two-operator technique frequently if there's more than a little volume needed. You'll see that the operator holding the ultrasound machine is also holding the needle, because that's ideal. They're putting the needle underneath the probe so that you can see it in a long axis. As a reminder, when we talk about short and long axis for procedures, it's about the relation of the probe to the needle. We covered that in another video. And additionally, the goal is for you to then walk that in through the whole way while this tubing is connected to your assistant's hand and a syringe there full of medication that they can inject as they need. Okay, but for our purposes, all we're going to be really focusing on is the actual needle driving part of it. So what that looks like is long axis. So as a reminder, here's the probe, and right underneath the probe is the needle. The reason this is in long axis is because you can see the entire length of the needle as you manipulate the needle in the probe itself. If this was in short axis, you would only see a tiny dot, and you'd see just a cross-section of the needle itself instead of the entire length. Hopefully that makes sense. We use the vascular or high frequency or linear probe for this. All of those names are acceptable, though we typically tend to avoid the label for the actual body parts. We don't prefer vascular. We typically call it a high frequency or a linear probe. You should always use a probe cover. And then this is what the procedure looks like. So I'll walk you through anatomy before we start the video. Up here you can see skin and subcutaneous tissue. This is the top of the ultrasound itself. Here is skin and subcutaneous tissue right underneath it. As the beam goes down, the deeper the object is in the patient compared to where the beam starts, the deeper the object is on the screen. You'll then see that right here you have muscle, layers of muscle. There's another muscle here. This looks like a blood vessel. And this right here is a nerve. I believe it's the median nerve that hangs out all by itself. All the way down here, this bright white thing that doesn't let you see anything beyond, that would be bone. So, what your goal is to move the needle in long axis from here all the way down without hitting the nerve itself, because that can be very bad, and inject local anesthetic. So there you see the needle coming in. They're right next to where the vessel should be. They're injecting a small amount of local anesthetic, and you'll see that that space starts to open up, and it separates nicely. And then as they're doing that, they're coming very close without actually hitting the needle itself. A clinical example of when we choose to do something like this is for a hip fracture. It's called a Fasciae Liaka block. There's 4 different variations of that block that are commonly used. But essentially, this is the anatomy you think about there, is you're looking to try to get next to the femoral nerve. You're getting above the iliacus muscle, and in this space, you're essentially trying to pop below this fascia, and then inject here so that in this plane it separates out. That's what it looks like. You'll see the needle coming in on screen, right? Over here you see femoral artery, and then you're looking at essentially this plane here, which is where you want to end up. Okay, they don't have the best view yet. Now they're trying to do a test injection to see where they are, and you can see that the spread is happening right over here. And then they were a smidge deep, so you'll see that they've pulled back, and now they're injecting over this way. The vessel is getting dissected out, and now you can see that nerve a lot brighter. So this is a very, very brief introduction to how nerve blocks work. Again, the concepts I want you guys to walk out of is what we use them for, how they're used. I want you to focus on the axes that we use, the short and the long axis. This is a long axis procedure. And then we talk briefly about how various structures appear in ultrasound. That will end up becoming relevant in future sessions. If you have questions, please feel free to email me.